All right, so we're basically ready to roll.
Ask a good question.
Yes, I am Aaron Hilton. I run a company called Steampunk Digital. Just the kind of the inside connection amongst this panel, just to declare it so you all know. Angela Robert is the CEO of Conquer Mobile, and I am chairman of the company. So I'll try not to play favorites too much. So I started up a new company, Steampunk Digital, to explore virtual reality and mixed reality technology, to develop it. I get paid to do the R&D that I get to feed back to Conquer Mobile someday to step up the VR play. So I'm sure there's some really cool stories there in the introductions. So let's kick this off. Does the clicker work? Oh, yes, okay, I've got control. Yes, all right, so we're gonna do a quick little 3 minutes or so each, and I've got your videos after each of your intro slides, so. Cool. Right, so here we have Timothy. He's, you and your wife have been doing some interesting research into PTSD and getting into how to apply virtual reality technology. So tell us a bit about what you do.
Sure. So I'm CTO of both IDEGO and Underminer Studios. I think we have some information right there for Underminer. What we basically are trying to do is democratize mental health. In the United States, which is where we're from, mental health is a major issue. We're talking about 43.4% of Americans, according to 2015, were diagnosed with a mental health issue. And that culminated in $203.6 billion of spending is the projected for this year of 2017, with a 38.1% growth. So we're talking about a massive cost to society. We're talking about including, I mean, those numbers, just if you think about it, only talk about what we're actually spending and putting in. That doesn't include sick days. That doesn't include family members having to help. Grievances lost, things like that. It only is what we pump into our system. And so the American market can obviously no longer bear what is happening. And so what we're trying to do is we're trying to change and flip it on its paradigm entirely on its head. So going more towards self-care. Baylor actually just released a study recently saying that self-care within a margin is almost as useful as actually going to a doctor when it comes to virtual reality therapy. So what we do is we're doing fears and phobias. We're showcasing that actually downstairs with IDEGO, which is the virtual reality therapy company. We have 4 different levels. Each one of them become more realistic as they go along. You have calming worlds at a click, and what we ask you to do in each one of those worlds become more like your fear and phobia. The entire idea behind that is desensitization. And as people become more desensitized to whatever their fear and phobia, they'll be able to face it on a regular basis. We basically want to make it to where it's democratized, taken down to everyone. So we want to be able to help anyone, no matter the economic level. So we're talking about homeless and prison populations, and be able to bring that out.
We got your video. So
Please.
We can roll that.
Please do. Obviously, as you're saying, the visuals are changing. Level 1 was fairly toony, and then level 4 becomes obviously much more realistic. And then we're about to showcase those calming worlds. So the entire idea is that you don't want to feel like you've failed, because you've never failed. You're just trying to figure out what works for you. It allows you to slice up any of the different worlds and kind of create almost a try before you buy situation. You go into a world and you're like, wow, I can't really deal with this. But nevertheless, once you go ahead and switch back, you may be able to deal with it. So obviously right now we're showcasing Fear of Heights. It's something that's very easy to go ahead and show at different trade shows and whatnot. But we want to be able to get the word out there that virtual reality therapy is an extremely useful tool. It's been around since about 1992 in its current form and is one of the major modalities for PTSD that the U.S. government uses. So.
All right, next up, Angela Roberts of Conquer Mobile. So you guys have been building Periop Sim for a while now and been developing some market traction within the hospital care industry and hospital, sorry. I'll let you talk about Conquer Mobile. You're best at it.
All good. So thank you guys for having me here today. It's really exciting to talk about what we're up to. For the last 3 years, we've gone down a path of exploring medical simulation. We really started going down the path. We started in virtual reality and shifted quickly to the iPad because we knew that the adoption for VR was going to take a little while, and it was easier to sell iPad simulation to hospitals as opposed to VR. What we've been finding over the last 3 years is that the technology's really caught up to being able to commercialize a product. And we're seeing a lot more interest from the market, I would say about 6 months earlier than I had anticipated. One of the interesting things about the medical industry and medical simulation industry is they've been using VR technology for many, many years, like I would say over 10 to 15 years, and they've really taken a page from aviation simulation, which have been doing it for a long time. They build virtual reality simulators, albeit using an older generation of virtual reality technology. So, one of the things that we did quite a few years ago in 2014 is we went to the simulation conference, looked around to see what kind of technologies were being used and who was buying it. And it's a really, really interesting market to sell medical education into. These are people that have operating simulation centers, either attached to a hospital or attached to, most commonly, a university. And they buy hardware, lots of hardware, and they have people coming in to train on a very regular basis. And one of the things they like to use simulation for is to get people to practice a really risky situation before going and practicing on a patient. So it's really, really important. Right now, the number 3 cause of death in US hospitals is medical error. So number 1 is heart disease, number 2 is cancer, or you might want to switch those. But the third one is medical error, and simulation has been basically said to be the best way to prevent medical error. So when we started going down this path, it made me really excited that we could use our technology skills, and my background's building video games, so I can use a lot of that talent to solve major problems and hopefully save a life.
Let's roll your video.
Okay. Started off doing consumer apps, and then we transitioned to building mobile apps for business purposes. So what I'm showing here, this is Periop Sim. It teaches operating room nurses what instrument to pass to the surgeon.
Conquer Mobile is now focused primarily on health and safety. Periop Sim, surgical training for nurses, industrial enterprise safety, for example, mining, right through to building a Parkinson's app.
In the medical field, it's a really interesting area where there's a lot of promise.
At Conquer Mobile, we talk about education as an experience. We're bringing together our gaming expertise, UX, mobile, simulation, virtual reality, and creating an immersive educational experience.
They can use the active learning before they go into the real scenario. With VR, we're taking it to the next level. The students are getting really, really immersed in their working environments.
Great job.
Our simulation gaming background really helps us develop many hours of education play, make it engaging and exciting for learners.
Great. All right. And next up, we have Maxime Ros. Maxime?
Maxime.
Sorry. I keep on getting that messed up. Thanks.
You gotta have the French accent, Aaron.
Not used to French.
You will hear it.
That's okay. Maxime's done some pretty neat tech around putting on a kind of a VR video experience inside the operating, like just kind of presencing on surgery. And talk about what you've been up to.
It's not a world simulation. We have designed what we name an immersive tutorial. The immersive tutorial is the way to produce your own content. You have designed a rig to support a hardware to record the first point of view of the surgeon, and this is unique because for the first time you have access to this first point of view. You have 3D for the depth. It's important for the younger students. And after, with the virtual environments, you can add relevant data to explain, to have access to the CT scan, to the MRI, to the clinical case, describing the patient characteristics. So this is the recipe. In fact, first point of view, 3D, virtual environment. And now our model is to give it to universities the ability to do it on their own. Once they have done this content, they can upload it on the platform, and each one can create this content. The way to produce it is not really expensive, and the way to diffuse it is even less expensive because it is on mobile. And what is crucial, thank you for having given all the numbers for medical errors. It's a crucial problem. And on the other side, there are 5 billion people in the world, with 6 or 7 billion. 5 billion people lack access to proper surgery, not only because there are no surgeons, but because there are no the good way to learn. And even more, the WHO has given the surgery as a top priority, international top priority right now, because in order to keep all of us in a good health way, the workforce, the surgical workforce needs to double at least for the next 15 years. So you clearly understand that there is big issues concerning the teaching of the surgeons.
Wow. So that's why we got to build this kind of technology. So we got to grow it. So let's play your video.
Yeah.
Hope nobody's squeamish.
Now, this one is not very bloody. But, if you come on the booth, we have something which are very smoother. But this is the receipt. You are immersed, seeing through the eyes of the main surgeon, and by this way, you are already improving your memorizing process, because you spend all your residency being beside, and you never have access to this point of view. And this is very, very, very important. And then, so it is an arm, and you have the step-by-step approach, which is described on the top of the screen with the different chapters. We edit this corresponding to this approach. So this is a flap. This is an arm flap to reconstruct the throat. And you will see after on the side, each side of the screen, we add different data. So this is a CT scan for the arm, because there is another team which is ENT surgeons that are reconstructing the throat. This is why there is the skull there. And also on the other side, you will see, for example, you can add a 3D reconstruction. This was the very first model. We have improved it also. And we can add the PowerPoint. We can add another 2D movie to clearly explain what is going on. And this is why virtual reality is so sexy in this way.
Very awesome. Very cool. Very good. Okay, so now is kind of the time where we start poking you guys with some questions. I don't know if you had a chance to review them, but here we go. So why are you passionate about VR and the whole medical field? Like, what pulls you in? So
Sure.
Go ahead.
Yeah, no, I actually come from a video game background. I spent 10 years. I was a technical artist, and I actually was in 2013 diagnosed with PTSD myself. I had multiple head injuries. On top of that, I have 2 small daughters. And for me, there was no answers. And the answer was, especially in the American market, take drugs or talk to someone. And so that's really kind of all I had. And then, talking to someone's expensive, not only just time, money-wise, So, you know, for me, I wanted to build a better world, and so I teamed up with our occupational therapist who spent 20 years doing AR and VR technology, helping gentlemen who came back with PTSD. He's an owner in IDEGO as well. And so what we're really trying to do is we're trying to bring it to everyone through, you know, my pain. Hopefully other people can heal.
Cool. Very cool. Maxime.
For me, I'm still a surgeon, a neurosurgeon, but it was to answer to a problem that I have lived myself, to say that, as I said, you are beside and you lose a lot of time in operating room, not having access to what is going on exactly. So we lose time, and now you can see that surgeons, when they have finished their residency, they are less performance than 20 years ago. So this is why I think I wanted to find a way to reproduce it and to give access, to share this knowledge. And I think what is very important, and which is the point between the three of us, is to know the emotional engagement that you have thanks to VR.
Agreed.
Yeah, I really want to second, you know, the comments made by both of you. My dad suffered from PTSD twice, injured in 2 workplace accidents where he was being trained on the job by somebody else who told him to go into a dangerous area and almost died twice, lost the feeling of his arm. So PTSD, huge benefit, and there aren't a lot of, you know, ways to heal people that have gone through that. Another thing that you mentioned, Maxime, is that when you're learning and training, and I saw this from observing, because I'm not a clinical person, I'm a techie, went into the operating room, and the people that are learning can never be from that point of view. So even as a perioperative nurse, you're trying to follow along and hand things to a surgeon when the surgeon asks for it, but you can't really see what's happening inside the opening as they're going along. So it's really hard to have the mental cues to be able to anticipate, because anticipation is really important. I think with the reason I'm really passionate about virtual reality is that I mentioned there's all this old school virtual reality technology, which is really great, serving a purpose. They've got really deep physiology and understanding of how to teach people how to do certain things. But with the new technology, VR, and even on mobile, we're opening up all these areas that you can simulate and train that were never possible before. And so there's a bit of a green field of, you know, how to teach, what to teach in the big sort of teaching area that exists. And I think that's what I'm really excited about. And of course, being a techie who's able to impact lives in a positive way is, yeah, really, really great.
Cool. I can tell you what I'm excited about is being able to build all this cool technology. You get really close to like all the like really top medical people in the field. So if you have a really bad issue, you get the best care. So
We all know a neurosurgeon now.
you know the right people. You rub right shoulders. What about this? How do you find working with Oculus, Vive, Gear VR, and in the field of medical training? So, Tim?
I can go for sure. So, I mean, each one of them, I believe, has a different use case. If you're trying to hit the largest market, of course, Gear VR is going to be, you know, your larger touch base. PSVR being the second. Obviously all behind cardboard. But if you want a truly immersive experience, being able to go ahead and have room scale that functions appropriately, and you know, we can go into what Oculus has the ability to do in the newest version, and it's supposed to be way better, but nevertheless, being able to get your hands in there and being able to set up and having room scale that works appropriately every single time is extremely important, especially when you're talking about presence. And so, especially when we talk about in the medical field, a lot of the times when we go towards medical, and I think it's phenomenal that more people are getting in from the gaming world and entertainment, presence is your number one thing to getting people to be in that world and being able to help in that world. And so I prefer Vive. I've done plenty of Oculus and plenty of Gear VR, and we'll be moving our stuff over towards Gear VR coming up in PSVR as well. But nevertheless, personally, I'm a Vive guy. So we'll just leave it there.
Maxime.
As Tim said, those are different markets, in fact, and I think each one has its place. For us, the purpose is to diffuse this knowledge. So what I like to say is that we're a kind of medical simulation center in pocket, in fact. That I totally agree that when you have a Vive and or an Oculus, you don't have the same possibilities. So in terms of interactivity, for example. So some things are, I don't see every student, even more in the third world, having access to HTC or Oculus. So this is why we prefer to develop on this. But I totally agree that I think it's an add, it's another tool that can be added in a whole program of simulation, one simulation program.
Mm-hmm.
Great.
Angelo.
Yeah, I agree with the comments on it really depends on what you're trying to teach or what you're trying to simulate. You choose platforms accordingly, and you also have to look at how people are going to buy and how they're used to purchasing things. So one of the things that I think a lot about and have thought a lot about is commercializing. So right now I can sell a Periop Sim and an iPad costs $250 for hospitals to purchase, or we just gave the specs for a VR laptop and an HTC Vive, and it's closer to $3,000 for them to have the VR experience. So, you know, really thinking about how people are going to, you know, be able to get your applications and get the technology. And there's also considerations. So, you know, Maxime, when he's teaching a lot of residents, you know, it's easy for them to have mobile VR versus them all buy a high-end computer and an HTC Vive. Whereas a sim center, they're used to buying expensive computers and specialized hardware. So I think there's a real difference. And some of the headsets, too, can connect with existing systems. So one of the things that I saw at the simulation conference, there's actually, I think, four new school VR product prototypes that were at the conference, and one of them was an Oculus attached to one of the haptics simulators. And so that's a really, really great example of you know, different technologies. And there's another really great use of more AR technology, which was with the Microsoft HoloLens and an echocardiogram simulator. All of them were great for their particular use cases, but all very different.
I think in just rolling back into it, as the technology moves forward, we'll get many, many more self-contained packages that we're, you know, here we're talking about mobile. It's going to be its own setup, and obviously there are a lot of players that are trying to push that right now, and that'll be the sweet spot. I mean, Microsoft is really kind of pushing right now to have the Inside Out at a cheaper price.
But I guess, yeah, so it's interesting. Microsoft, when they originally launched their HoloLens, it was terrible for tracking,
Of course.
precision. But over its lifetime, it got incredibly good. So, hey, we've got to play with some good HoloLenses now, and it's a $3,000 device still. But the interesting thing is, it seems to be a software problem on that front.
Yeah, it's software versus hardware, so they're being intelligent about that, and obviously they've brought in a lot of those lessons that they learned into the newest version of the headsets, as they're doing with Acer, Lenovo, and Asus.
Yeah,
and that's important.
Just this.
No, it just doesn't work.
It doesn't work for me.
You gotta go like that, and you know, I got big, you know, like forearm thing. I don't know what this is, but yeah, that hurts. I'm like,
but I feel like, you know, if they could apply that that technology that they've developed and improve the field of view. You know, the HoloLens 2, and it had a controller, so positionally tracked. You know, maybe teamed up with like a next generation Leap or something. I kind of feel like we're quickly getting in the direction of something that could be potentially very game changing. But we need, I guess, for Maxime's case, scale.
Yeah.
We need to be able to address scale. So.
I definitely believe that your sweet spot's really going to be those self-contained units for sure.
Yeah.
And I'm pretty sure also that the development for HoloLens, what you have developed so far with virtual reality, can be after transmitted to HoloLens. So those are not the same use case also. For example, as for the moment, it's a preview or review of what they are going to do in the operating room. But you can also think that you can use this mixed reality to be used during the surgery also. This is not the same use case, because if you have mixed reality, you don't want to see the patient on your table. Okay. This is different, I think.
Well, and then you get into like hollow presence.
Yeah.
And that's super helpful, especially in your world. Yeah.
Totally.
So this gets us right into that other question, which is kind of looking at what we have today, and what is it that we can do right now, and what is it that we could do potentially in the near future?
I'm going to say we're pretty limited right now. Technology, most of them cost about 30% of your CPU and considerable amount of your GPU to go ahead and run any sort of simulation or any sort of experience. When we go to mobile environments, we're talking about thermal throttling. So, once the phones start getting hot, they start slowing down. And mobile environments, as far as the CPU strength, they're only about 2 years, 3 years behind the times as far as something that's midline. But as soon as that heat hits, man, they're almost useless when you're talking about pushing extreme visual engagement. So once we solve those problems, then we're going to be in a really good space. I do believe I'm seeing a lot of market push, and a lot of people. The other company that we do is Underminer Studios, where we go ahead and we do anything that's bleeding edge. And I've had a couple of different companies that are interested in us building out chipsets for full units in about the $400 to $450 range, which, at that point, when you're talking about a fully engaged unit, that's going to be great.
Yeah. I got a plug. If
Go
you
for
guys
it.
want to come and check out the Cube booth, it's towards the far end of the hall. I have a bridge headset, which you guys might be interested in checking out. You pop an iPhone into this bridge headset and run a mixed reality experience on it. So it's developing very quickly, but it's a $350 US add-on, $450 I think with the sensor and everything, add-on that you can just pop an iPhone into, and so you use existing phone. And I think that other technologies are going to come out. They're much more mobile enabled, and enable us to get into this future position where everything's positionally tracked, everything's stable in your field of view. You have a wider field of view. You have no blinders on. You can see your open environment. I think that we've got some interesting potentials there.
Very true.
Angela, actually, I'm going to jump to Angela. I'll get back to you, Maxime.
I don't know.
Just mixing it up.
The women first.
Mixing
The
it
women first, please.
So actually, just to kind of talk a bit about the reason why I spun up Steampunk Digital was to focus on developing technologies that could be enabled. And actually, the interesting thing about building an iOS-based mixed reality tech is potentially tying in with Conquer Mobile's existing technology on the iPad and enabling it to do full VR and augmented reality type experiences, because you've done both.
Yeah, so there's a couple angles that I could come at this one. That's definitely one of the major angles is how do we get VR into operating rooms? What's the easiest way to do that? And we're creating a channel through the iPad, and people could potentially bring their own devices and all connect up with the simulation system, similar to what you were mentioning, Maxime. But how do we bridge them from a technology perspective so they don't have to? I was talking to someone today about it costs $3,000 to get a good VR setup for Peri-op Sim. And so from a commercial perspective, that is really, really interesting. As well, like one of the things I'm thinking about in the future, I don't know how many people remember Halo when Halo came out and you had just kind of the Halo map of all the people playing in the world. And one of the things working at Electronic Arts that I thought was really powerful was when all the online and matchmaking started to happen. So one of the sort of forward-looking and future things is doing team training. So one of the challenges is trying to get a surgeon in with nurses and for them to learn together, and even with an anesthesiologist. How do you get everybody in a room and practice? So how about sort of the online matchmaking and getting multiple people into a scenario over online? That's really interesting to me. I think once we do that, I think that really the level of, because a lot of people, this is one of the challenges that I'm struggling with right now. So you're creating a simulation. How do you realistically, with the budgets that we have, because we don't have the Electronic Arts budgets to build these products, right? We don't have multiple millions of dollars to build one of them. How do we not create animations and AI that are horribly in the uncanny valley, right? How do you be able to, pick up someone else's movements in another place, or have really, really interesting AI in order for people to have a more immersive experience? So I think that's one of the challenges of where we are from a technology perspective today, but I can see that really improving in the future. And Aaron's got a mic.
You can talk in my ear.
Well, I think it's
There you
Maxime's
go.
turn, right? It's your turn, Maxime, anyway.
Yeah,
Well, Aaron is
maybe he
doing
has
that.
something to say before.
Oh, okay.
Alright, gonna put this back on again.
Don't give him a chance. Just go with it.
So I think we all agree with the fact that mixed reality with teleassistance, in fact, will help the workers. And you just introduced another notion that I think is very, very important, is also all the stuff that is being done right now with AI. Because we create experiences for one user, we can change the environment, but we can also study from this user experience and have a scientific data in order to understand the behaviors. It has been already done at First Virtual Reality. You mentioned that the first scientific studies have been performed 15 years ago. And for example, for autism, they were already learning thanks to the big VR headsets on the head of patients in order to understand different clusters of autism. And I think that with the powerful technology that we have now, we will be able to do very far in the understanding of the human behavior. But at least, and I think it is very important to point this because it's also could be used in a wrong way. So we have to be aware of this, and I think this is also our role to make people know, to make the politics know that we should have a legal text just to say that be careful, this is very, very, very interesting, but this is very powerful and could also hurt sometimes.
I kind of wonder, with some of the games coming out, they're like full-on horror, shock horror type things. But when you have such an immersive experience, we might have to have shock horror game paired with psychological rehab. We need your product to complement the horror game.
We're actually working on implementation right now.
No, it's important what you say because sorry.
Go ahead.
In the simulation, what is very important for all kind of simulation, even a world game, the simulation at the end you need to have the debriefing session, or the simulation you will all forget. So it's the kind of rehab that you are talking about. This is something which is very important. And for example, even if for us it was videos and not you have an emotional engagement, but I have someone who has tried this, one of our app, the arm, and he came back 2 days after telling me I couldn't sleep because I thought it was my arm.
Yeah.
There was a kind of disruption with its view, and so this is why after now in the discussion when I present it, after I ask everything all right, you want to discuss about something more, to give them the opportunity to have this kind of little debrief also, because they are not surgeon and maybe they can be shocked.
Right.
That's good.
Well, and that's just one, I'll be super quick, but one of the educators that I talked to, perioperative educators, said when OR nurses are training and something goes really wrong, PTSD in the medical industry for clinicians is a very, very real thing.
Have any of you heard of ASFR? I forget what
I don't think so.
it breaks down to. Something, it's a part of the brain that can synthesize stimulation for taking whatever you see or hear, and it can synthesize a stimulation on your body or in your body or that sort of thing, and it's part of the memory center. So it's for helping you recall more effectively. And some people experience it a bit more, but it's an interesting thing with just spatial audio. Spatialized audio that's positionally accurate, has all the filtering effects of an actual head case. So like microphones in a model of a human head in the ears. And there's a whole thing on YouTube. Look for ASFR on YouTube, and you'll see that there's like these videos and video streams of experiences of people in basically the first person point of view is the camera, and you hear and you get this kind of like, some people get this tingling sensation on their neck, or they feel like they're there. And that's a different form of presence than necessarily VR, but it's very powerful how the brain works to fill in the details. And yeah, you can get in your dreams, in your sleep, this arm problem.
Yeah.
Was that my arm? So let's go on to the next. What is the next big milestone that we'll see with VR in the medical industry? What do you feel is going to be the next big milestone?
I can go first, sure.
Go for it.
So I really believe it's going to be the use and the democratization for us, at least on our end. Obviously, my focus is on fears and phobias and training and treatment. So obviously this right now is the first time that we actually have the ability to go ahead and put this into every therapist's office. And so at that point in time, it becomes something that you just go find a physician who says, yes, we do virtual reality therapy. That's obviously what we're doing. And then as well, the acceptance of self-care. The data is out there. It's definitely very useful, and it's obviously not as useful as being able to see a clinician. But especially when we're, obviously my focus is American market. When we're talking about American market or other third world countries, being able to see a clinician is not something that's capable for most people. So I think those are our two big pushes. So,
Maxime?
The adoption rate. I think this is, you are totally right to say that you wanted to also to produce on tablet and on mobile device, because even if we feel that there is this big wave, it's step by step, in fact. But it makes also sense, and when we are dealing with tablets, remember, we spend 10 years to have the tablets that came in and that are being used now by university. Even if anyone has one tablet. But at the beginning, when they presented you a tablet, it was, well, I have my smartphone, I have my laptop, what do I need? Something between the two of them. So I think the adoption rate will be the key, and I'm pretty sure it will, but we need it at first.
Just takes time.
Real quick, Angela.
I'll be short, and I agree with both of them.
If there are any audience questions, we've got a bit of time to answer something that you might have. What's on your mind? I think we've got microphones coming up. If you don't mind waiting, we
Yep.
are recording. This will help get it on the track.
Hi, thanks so much, guys. This is incredibly interesting. A lot of, I guess, for Maxime and Angela, you guys were talking about, educational tools and et cetera. And I'm wondering, have you guys thought about, not just looking at residents or nurses that are already there, but also going to universities and schools and maybe even getting students at, so I'm a university student, so getting students at like high school level so that they're really equipped with this kind of VR. So when they get to that stage, they're well in tune with the VR. And I'm wondering, is kind of acceptance with students or practitioners a challenge that you guys face? Or are people readily willing to learn through VR right now at this stage, even though they've never used the technology before?
I think that they're ready to use it. I think from a content creation perspective, and then the university's ability to pay for it or budget and find a way to incorporate it into the curriculum, I think that's the real challenge. So what we see a lot is that teaching for universities and for, say, residents, a lot of the go-to-market strategy is to consumer, so it's direct to those individuals because they're willing to pay for it, but they don't all have the HTC Vive, so that's a bit of a blocker. Whereas for mobile VR, it's really, really straightforward. I think one thing I would love to see is that once we have all of this wide open area being able to be simulated, instead of kids having to follow their parents to school one time a year, once out of their sort of school years, they could actually do all the jobs in the world before they graduate high school and see what resonates with them. So that's kind of a big sort of vision that I'll leave with you.
Yeah.
For us, we have the first business model that we have developed so far was regarding medical device companies that wanted to produce in a new way their operative technique. So it was a full service model, and there was someone who went into the operating room to bring the recording system, edit the app, and blah, blah, blah. We had demands for a new model from customers or also users. Means that there are surgeons in the world who ask us, how can I do it myself? And also universities. And also other kind of industry where you have some secrets and you want to share it with the recording technician, of course. So this is the new model in order to deliver the proper way to do it on their own. And each one will be able to take part of this platform and even more to monetize access to a part of the content. We have also designed, it's another model which is more freemium but for humanitarian purposes with operative techniques which has been described by the World Health Organization to be a priority for emerging countries and third world countries. And so you can imagine the World VR platform, you enter this access and then you have some ones who are willing to share with everybody, and the other one who wants to keep their secrets. But the fact is that each surgeon, each technician has its own style. So what is the surgery which is performing now in Vancouver is absolutely not the same than in Seattle, for example, and it's the same surgery with the same devices, but it's not the same surgeon.
Should we just take one more question? Yeah? One more question. Whoa, a bunch of hands.
There's a lot of hands, yeah.
You had your hand first. All right. Fellow in the back. Yeah.
Hi, my question is, like in the medical field, there's a lot of regulations and stuff like that. And so for people who want to get into this area, do you have any stories to share or advice to give in how to navigate that aspect of, you know, all the regulation and everything, and how to get your product in?
I can talk obviously on the American market. Lawyers, get out there. It's funny, it really is, but I can honestly say one of the bigger things as well is look at patents. That really helps you out. See what else is out there. Medical patents are, you know, in any patent you can just do a quick search and see, you know, what is already been done and what is being done. As well, you can go ahead and search and see what's been FDA approved. Which is really cool. In my world, I found out a gentleman named Skip Rezzo pushed through Gear VR and some of his modalities, so I can go ahead and go off his coattails and push my stuff through. So stuff like that is really helpful. If you can find that somebody's done something like what you've done in the American market, you can go ahead and get it done through a like medical device. So I would recommend just trying to see if you can find something that you can go, oh yeah, no, this is totally the same thing, and just try to convince them that it is. Yeah, so.
I think there's a real, you got to look at your concept and whether or not it's therapeutic or educational. They're treated very differently. I think Maxime should agree and add some color to this. I think the biggest, and this is really only a hurdle mainly for our iPad application, but with filming in an operating room. So that's something that I think is novel. And so hospitals have to get used to that, and you have to make sure from a legal perspective you have all of that taken care of. But just see what area in medical and whether or not you're capturing, like, one design piece of advice is try not to capture any personally identifying information. If you build your whole system without any of that, you don't have to worry about HIPAA either. And that's one of the reasons, that's one of the reasons we went and really liked education as opposed to therapeutic, because it was a little bit more straightforward.
This is exactly it.
We need to
Thank
talk
you,
more,
guys.
Maxime.
Lawyers and laws.
Your attorneys, and the fact that you have to decide what is your plan and what is the subject. If it's to treat patients, then you are under, in each country, in US it's FDA, okay, but in Europe you have the same. You need this approval, and it costs a lot, of course. And if it has an input on the patient, you will have it. So you have to think about the minimum efficient value that you can have for your design in order to make a step-by-step approach. And if you have to prove that it's non-hurtful for the patient, that it respects all the rules, you have to do it in a step-by-step approach, or you have a lot of money and you have a lot of attorneys, and it's okay. But consideration upon startup, you have to do it in another way. But it's good because you need to think this way, and you need to have each time the good value on what you have developed, and I think it's the good way. Yeah.
Okay, one final thing, just to wrap up, is how hard is it to sell into your respective markets in this kind of medical field? How hard is it to sell this new technology into this field? Hard, not so hard, easy?
For me, it's very hard. Me personally, obviously our team includes people who are from the medical field. So, I'm kind of caught in this little gray area. Are you a therapist? No, I'm not a therapist. How can you say that these claims are true? Well, there's research. I mean, people at this point in time go, well, VR is so brand new. No, it's not. It's older. And so for us, and for our specific project, it's that caught area. So extremely difficult for me. I know when Eric comes around, Eric Johnson's our chief medical officer, he it kind of lends this whole teamwork thing, which is what's phenomenal for us. But yeah, man, it's tough.
Maxim?
It is the same problem that people cannot figure out exactly what they will live in VR, because we are still in a 50% rate of people who have already tried VR. So it's like on tablet at the very first, you could explain, we will do a software tablet application, it will do this will have these features, but people cannot figure out. Now it's okay, but it's the same for VR. We have to wait that people has tried. The second thing is the wow effect. You have a lot of wow effects. Wow. When you are on booth, there are lot of people that comes and like this, but after is to find the right way to introduce it into their environment. And finally, the easier way, it's when we have different people with different profiles in the same room, and they tried it, and then they can brainstorm and conclude in 1 hour. But we have to reach this point to be sure to be able to sell.
I would just really look at selling into medical, selling into education sales cycles, and then applying the technology adoption life cycle to that. And so I think that what we're seeing is in line with those methodologies. Like, I'm not seeing anything outside of that, or that's really out there.
So you just have to cross the chasm.
Yeah, well, let's get get the innovators first. We're still on getting the innovators, which the innovators are flocking to it, which is great.
That's cool.
Yeah.
All right, thank you very much, everyone, for coming out to the Med panel.